Welcome, everyone. We're diving into the world of dental hygiene today with a focus on deep cleanings. Now, you might be wondering, what exactly is a deep cleaning? It's a thorough procedure that goes beyond your everyday brushing and flossing, reaching deep below the gum line to remove harmful bacteria and stubborn plaque. This not only helps keep your teeth and gums healthy, but also contributes to your overall health. Poor oral hygiene can lead to a host of problems from gum disease to heart disease and even diabetes. So your dentist isn't just safeguarding your smile when they recommend a deep cleaning. They're protecting your overall well-being. And here's something you might not know. There's a difference between a regular cleaning and a deep cleaning. While a regular cleaning focuses on the surface of your teeth and gums, a deep cleaning goes well deeper. A deep cleaning is a crucial part of restoring a healthy and radiant smile. Now, you may be wondering, what exactly is a deep cleaning? Well, my friends, a deep cleaning, also known as scaling and root planing, is a procedure that treats gum disease at its source. This is a non-surgical method that removes harmful bacteria and toxins lurking beneath the gum line where regular brushing and flossing can't reach. How does it work? Dental professionals use specialized instruments for this process. First, they perform scaling, where they meticulously remove plaque and tartar from the tooth surface, and from below the gum line then comes root planing, where the roots of the teeth are smoothed out to prevent further bacterial growth and to help the gums reattach to the teeth. This procedure is done with great care and often under local anesthesia to ensure your comfort throughout. There you have it, a comprehensive understanding of what a deep cleaning entails. But why is it deep cleaning so important, you may ask? Well, let's dive right into it. Imagine plaque and tartar as uninvited guests at a party. They hang around your teeth, overstaying their welcome and causing issues. If not addressed promptly, they can lead to gum diseases like gingivitis and periodontitis. And trust me, those are parties you don't want to attend. This is where deep cleaning steps in. It's like a dedicated bouncer showing these unwanted guests the door before they cause any trouble. Reaches those places that regular brushing or flossing can't, ensuring that every nook and cranny of your teeth is squeaky clean. Here's the thing, a deep cleaning isn't just about maintaining oral health. It's about stopping problems before they escalate into serious oral health issues. A deep cleaning is more than just a routine procedure. It's a more advanced measure against serious oral health issues. The urgency of a deep cleaning cannot be stressed enough. It's a race against time, a battle against the bacteria that threatened your oral health. Each day that passes allows plaque and tartar to build up, leading to gum disease, tooth decay, and ultimately tooth loss. Imagine a castle and its protective wall. Your teeth are the castle and your gums are the wall. Now imagine an army of invaders, the bacteria relentlessly attacking without a deep cleaning. Like leaving the gate open to the invaders, the consequences of delaying a deep cleaning are not just unpleasant, they're serious and potentially irreversible. Gum disease leads to bleeding, bone loss, swelling, and discomfort. Or still, if left unchecked, it can result in tooth loss. It doesn't stop there. Poor oral health can affect your overall well-being too, with studies linking it to heart disease, stroke, and diabetes. Procrastination is not an option when it comes to your oral health act today to protect your smile. Despite its importance, there are several myths and misconceptions surrounding a deep cleaning. One common falsehood is the idea that this procedure is painful. In reality, with the use of modern anesthetics, any discomfort is usually minimal. Another misconception is that a deep cleaning is unnecessary if you brush and floss regularly. However, even with diligent home care, plaque and tartar can still accumulate in hard-to-reach areas without periodic professional routine care with accurate information. We can all make informed decisions about our dental health. In conclusion, a deep cleaning is a vital part in restoring dental health. Not only does it help in combating plaque and tartar buildup, but it also plays a crucial role in preventing serious oral health issues. More than just keeping your smile bright, it's about maintaining your overall health. The urgency cannot be overstated. Make regular dental checkups and cleanings a part of your routine to avoid this type of cleaning. Remember, a healthy mouth is a gateway to a healthy body.